So, welcome to our last day of Healthy Week. And today's focus is all about you plus benefits. So, open enrollment starts on Monday, and we really want you to be prepared for what you need to know and what you need to do for open enrollment. Today, we're broadcasting live from New York from 30 Rock. We already have some questions in, which I'll be going through today. But if you have additional questions, please feel free to submit them. And you can email those to us. It's healthy_week@cable.comcast.com. Again, that's healthy_week@cable.comcast.com. So my name is Dan. I'm from the Global Benefits team, and joining me is Sabrina.
Good afternoon, everyone. I also am a member of the Global Benefits team. I'm happy to be here. Before we dive into your questions, I want to go through a few important items that I wanted to bring to your attention. First, for 2016, we're keeping it simple. We've got some great enhancements to help keep you and your family healthy, have great access to quality care with better outcomes and at a better cost. There's also more ways for you to find the right care and the right provider with services such as Accolade, using video chat with providers or physicians, as well as our centers of excellence. We also continue to have plenty of resources available to you to help you save money, things like flexible spending accounts, generic drugs, using in-network providers, and our wellness incentives. Best, because of the way our plan is designed, taking advantage of all the great resources that I just mentioned is leading to better outcomes and costs. While healthcare costs continue to rise across the country, at most employers, we are very happy to be able to share with you that we're able to keep our 2015 paycheck contributions for the Pay Now, Pay Later plan the same for 2016. So flat, there's no contribution increases for the Pay Now, Pay Later plans. That's right. Let's take a look at some of the questions that you've submitted. Know that you can continue to submit more questions by submitting them to healthy_week@cable.comcast.com.
Great. So the first question that we've already received is, when is open enrollment?
That's an easy one. It's November 2nd through November 20th. So it starts on Monday. Just go to My Benefits and you can make your open enrollment elections.
Great. So does someone still need to do something if they don't want to make any changes?
They do. We are asking everybody to go online to My Benefits and declare your tobacco user status. Even though you may have declared your tobacco status previously, we are going to ask you to go in and declare it again. So if you or a family member would like some assistance, if you happen to be a smoker or tobacco user and want to stop, we do have some great resources available to you online, again, at My Benefits. But do go in and declare your tobacco status.
Great. So the next one was, what about a flexible spending account? And is that something I need to be doing? So let me first explain. A flexible spending account, also known as an FSA, is something that is a tax advantage way to put money aside into an account, and then you can pay out-of-pocket expenses. So an FSA is really used primarily for two reasons. The first is healthcare expenses, and the next is either dependent or daycare expenses. So if you want to participate in an FSA for 2016, you actually do have to go in and make an affirmative election for that. And that's even if you had an election on file for 2015. So go ahead and make that election for 2016.
So even, I guess you have to do two things then during open enrollment. You need to go in and declare your tobacco status, as well as make your FSA elections. So
Right.
That's great tips.
Yeah. That's great. The first is company ACO. They're our financial coaches, and you can find out more information about ACO through the second, which is My Benefits. So go out to the My Benefits website. Those are two great resources for you to take advantage of. Our next question is that I keep hearing about centers of excellence. What is that?
Centers of Excellence are programs that we put in place to help you and your enrolled family members get access to top quality providers. We've really focused on certain medical conditions, namely surgeries that have to do with whether it's transplant or bariatric, but even things like heart surgery and spinal surgery and joint replacements. The best way to get access to the COEs or Centers of Excellence is going to be to call Accolade. So if you know you're looking at any of those surgeries, perhaps in 2016, give Accolade a call and let them help you get access to those Centers of Excellence. One other great thing about the COEs is that we provide a travel benefit. So if there's not a COE or Center of Excellence within your area, we'll actually pay for you and a family member to travel. Not in full, but most of those costs will be covered under the program. So it's a great benefit, and that's one of the enhancements that I referenced earlier.
Yeah, that's a really great benefit.
Yeah.
So I saw something on upluswellbeing.com about beneficiaries, and can you explain what that is and how do I declare? I'm thrilled to hear you were on upluswellbeing.com. It's a beautiful site, and you're absolutely right. A beneficiary is an extremely important thing to consider. A beneficiary is really a person, a group, or a charity that you can assign your money to if something were to happen to you. You can actually make that election throughout the year. So that's not something that's just specific to open enrollment. So if something actually changes for your life, you can actually make a change to your beneficiary at any time. You can go out to the My Benefits website and take a look to see about changing your beneficiary, and you could do that for multiple different plans. You could do that for your life insurance, your AD&D insurance. You could do that for your 401k. And if you participate in the employee stock purchase plan, you can actually do that for your brokerage account associated with your ESPP. So the next question is, I know I need to make elections for my health plans, but what about retirement? Is this my one shot to make an election for that?
Good question.
Yeah, well, that's a common misconception, I think, around open enrollment. And the answer is you can actually change elections for your 401k at any time. Really, it's a wonderful idea to think about your retirement plan while you're making your open enrollment elections. A lot of those things are really linked together. So go out to the My Benefits website while you're making your elections for open enrollment and really consider those two things hand in hand. But you can make changes at any time to your 401k.
Perfect.
So when will I receive the guide?
Ooh, that's another good question. I actually have a copy of the open enrollment guide here. This was mailed out to Comcast and Spectra Corps employees this week. At NBC Universal, there was a mailer that was sent out, but as always, you can get a copy where? My Benefits. You can get a copy of the open enrollment guide.
Great. So the next question is, what if I'm getting married next year?
Okay, anytime. If you're getting married, whether it's a newborn, you're adding a newborn to the plan, or you're getting married, anytime, you need to go on and enroll that new dependent, but do that within 31 days. So it's what we call a qualifying life event here in Benefits. Just do it within 31 days. We can get you enrolled and make sure any of those claims are covered as of the date of the qualifying event. So in my examples, as of the day of the wedding,
Or do timely.
yes, very important.
Yeah. So as a reminder for folks, if you haven't submitted a question yet, please feel free to do so. It's healthy_week at cable.comcast.com. We're waiting to receive your questions. And again, it's healthy_week at cable.comcast.com. We actually did get one in. I heard that Aetna is going away and will be replaced by United Healthcare. How can I figure out if my doctor will be in network?
Okay. Of course, you can go on to Accolade. You can call Accolade. Their number's on the back of your ID card if you're currently enrolled in one of our health plans, the Pay Now, Pay Later plans. But on Monday, when you go into My Benefits, you can also find links both to IBC or Independence Blue Cross as well as United Healthcare. You can click on a link there to find out if your physician is still in network. If you find a new physician, I just always recommend, even if they're on the provider website, go ahead and call the doctor's office just to make sure they're accepting new patients.
Yeah, that's a great point.
Yeah.
So our next question is, am I going to receive a new ID card?
Yes, everybody will be getting new ID cards for the health plan. So if you're enrolling, you'll get a new ID card. And something a little bit new this year is there's going to be a sticker on the front of that ID card. It's what we call COB, or Coordination of Benefits. The sticker is going to ask you to call into the plan just to certify whether or not you have coverage elsewhere. And that's a really good thing to do in advance prior to you incurring any claims under the plan, so that you don't have to do that in order to get any claims adjudicated after you receive services. So when you get the ID card, you'll see the sticker, call the phone number, just answer the questions. If you have other coverage, they're going to want to know who that is. Peel the sticker off and you're ready to go for January 1st.
That sounds great. Yeah, it sounds easy to do. Yeah. So the next question is, when is the ESPP enrollment window? And actually, we have 4 windows throughout the year. The ESPP buys shares on a quarterly basis. So the enrollment window is always the month before the quarter begins, and it's the 1st to the 15th. So for the next enrollment period, it'll be on December 1st. It'll run through the 15th, and that'll take place for any elections that you have, beginning for the first quarter of 2016, so you can participate in that plan.
Okay.
I heard my colleagues talking about the SpendSmart website, and what is that? Well, I love the SpendSmart website, I really do. SpendSmart is just a wonderful tool that we offer here at the company. It's really a cash back. Those are the two main components to it. And it's actually paid for by the company to run the operating costs of that, so it doesn't cost anything for the employee to use that. And so you could do that for your holiday shopping, and you can get cash back and discounts directly through the site. So go out to upluswellbeing.com for more information about SpendSmart.
Perfect. And one of our colleagues, Dan, I just heard, bought a new Apple computer, and she jumped onto SpendSmart and found a discount even at Apple.
Really?
So, yeah, that's awesome.
Oh, that's great.
Yeah.
Can't hurt to save money, right?
Use SpendSmart.
Absolutely. So I think those are all of the questions we've gotten in so far today.
See, we're also looking at a different monitor here. I think we might have some questions that have come in.
Oh, we did.
Here.
Yes, you're right.
I'll let you read those so you're closer.
Yeah. So it says, Sabrina, you mentioned that we have a video conference option with a doctor.
Yes, that's called Doctor on Demand. I know you've had really good experience too.
I've had excellent experiences, several times unfortunately, but several very good experiences.
Doctor on Demand is our telehealth program, and Doctor on Demand is great, especially if you have young children like Dan does. I also have children. It really gives you very easy online access to a physician or provider. For non-emergent care, if you need to go see a doctor, of course, we encourage you to go see a urgent care center immediately if need be. But otherwise, for things like, I know I've used them for rashes, poison ivy, things of that nature, you can use Doctor on Demand. It's online telemedicine. It's great. The doctors are terrific. They can even prescribe prescription drugs. I would also recommend, you actually told me this, to go online early to Doctor on Demand before you even use their services. Register yourself, your dependents, and also your pharmacy, so that when you do need their telehealth services, all of the information is already there, and you're not fumbling trying to find an address or a phone number for a pharmacy. So do that in advance and take advantage of Doctor on Demand. If you're not enrolled in the health plans, there is a $40 copay. But otherwise, if you're enrolled, there's no charge. So do use Doctor on Demand.
It is quite an efficient service, and really it's just a great way to get care at the right time and really efficiently, so that you don't have to go out and go to the doctor for something minor like that.
Right.
Yeah, that's great. So the next one is, I'm turning 26 in November. I'll be taking off my dad's insurance, and I want to enroll in the company's medical plan. How long will I have to enroll?
You will need to enroll in the plan immediately. We don't want there to be any lapse of coverage. I'm assuming you've already gone through any waiting periods and you're an existing employee. You'll need to enroll, if you're coming off the plan at the end of the month, you'll need to enroll for 2015, right, for the month of December, and for 2016. So go into the My Benefits site. You can make your election. You'll do them in 2015 first, followed by 2016, but you'll need to do that immediately to make sure there's no gap in coverage there.
Got it. So that sounds like one of those qualifying life events you were saying earlier.
Exactly. So technically 31 days, just jump on there, take care of it. It'll be done retroactive to that qualifying life event date.
Excellent.
Yes.
So after I sign up for Open Enrollment, when are my benefits effective?
January 1st. So
All
you'll sign up for Open Enrollment. Open Enrollment, all of those changes go into effect January 1st. So again, you'll make them for November 2nd through the 20th for an effective date of January 1st.
That's great. So how much additional per month is dental and vision coverage?
It's actually flat. We have really good news, not just on the Pay Now, Pay Later medical plans, but also for dental and vision, as those contributions are flat, so you will not see any paycheck increases to participate in dental or vision for 2016.
Excellent. So a question came in about the employee stock purchase plan, which is, can I give a little bit more about what the employee stock purchase plan is? The way that you can buy Comcast shares at a discounted price. And what it does is, actually there's two parts of the benefit. The first is it looks at the beginning of the quarter, the end of the quarter, and it takes the lower of those two prices. And then it applies a 15% discount. So really, this is a great opportunity if you're interested in purchasing Comcast shares, for you to do so at a discounted rate. So again, that's going to be a quarterly purchase. And the next enrollment period I mentioned before is December 1st. So if you have 15 days from December 1st, if you wanted to enroll or make change if you're currently participating, for the first quarter, perfect timing for this week. What is Sleepio, and how do you use it?
Sleepio has been rolled out during Healthy Week. Sleepio is a great online tool to help you get sleep. There's some great tools and resources on Sleepio. It's kind of been our big launch during Healthy Week. Hopefully you also may have received a desk drop with an eye mask and some earplugs to help you get sleep better. But do go on and use Sleepio, and you can find it on the Healthy Week website. And you have, remind me, at the upluswellbeing.com website. You can find tons of information regarding Sleepio on the website. Too many sites to remember.
Lots of websites. So the next question was, where can an NBC Universal employee find out about the long-term disability change?
All those changes will be on the My Benefits website. So any changes like long-term disability at NBC Universal, once you jump onto the website, it'll walk you through any changes that are impacting you that you may want to make for 2016. So all the specific changes by population will be on the My Benefits website. So that's a great place to go.
Excellent. So we have a pre-tax and an after-tax Roth option for our 401k. What is the difference? That's a great question, and there is a difference, and it is something that anyone eligible for the 401k is able to participate in. And a pre-tax deduction is something that actually reduces your taxable income in your paycheck, and then that money goes into your account, and then when you take it out in retirement, it's actually a taxable. So the money you put in plus all of the earnings are taxable distribution based on really on your income level and what tax bracket you fall in at that time. Whereas a Roth contribution is an after-tax contribution. So it goes in, it doesn't reduce your taxable income during the pay period from which it's deducted, but the earnings can be tax-free if you have what's called a qualifying distribution. So just a couple of certain restrictions have to be met at a certain age, and it has to be in the plan for a minimum of 5 years from your first contribution. It's not each contribution, it's just your first one. So if you take that distribution and it's a qualifying distribution on the Roth side, it's actually tax-free on the earnings. So you've already paid the money on the contribution that's going in, and then on the way out, all those earnings are tax-free. So it's really meant for people who have a longer time horizon to retirement. So it's definitely something to think about. So we mentioned before that checking if your doctor is in network, and why is that important?
Well, you can go to any physician. However, we recommend that you go in network because the costs are negotiated. And so any out-of-pocket responsibility that you may have is going to be lower when you go in network versus out of network. Again, our plans provide you with that flexibility to go to any provider. But if you go in network, your dollars will go further because their underlying fees are negotiated for both for 2016, United Healthcare, as well as Independence Blue Cross for the pay now, pay later plans.
Excellent. Yeah, that's a great idea to think about. Yeah. So I think those are the questions that we've received so far today. There are a couple more that just came in. I'm telling you, these are going fast.
We're looking at a screen here. Dan's
great.
kind of reading a screen that we're looking at for questions that are coming in. So
they're rapid fire now. So you said that we have a second opinion service.
Yes.
And how do I get linked up with the second opinion service?
You know, I'm going to say it, Accolade. Go to Accolade, numbers on the back of your ID card. Call Accolade. They can link you into Grand Rounds. You can also access Grand Rounds during open enrollment on the My Benefit website. You can go on, click on My Health, and right there it pops up Second Opinion Services. You can click on there, and you can get directly into Grand Rounds as well.
Excellent. Yeah. Just scroll here for a moment. Let's see if I can get to the next question. So it says, my colleagues keep mentioning Accolade. And I've used Accolade before myself, similar to Doctor On Demand.
Okay.
Do you want to explain Accolade?
I will explain Accolade.
Great.
Accolade is what I like to call our healthcare concierge. They really are an incredibly helpful team of health assistants that are there to help you, whether you have a claim question, maybe you received an explanation of benefits in the mail and aren't quite sure how to read it. You can call Accolade, and they have access to that information as well, so they can help explain that EOB for you, explanation of benefits. You may have a question about treatment. You may have a question about, obviously, open enrollment at in-network providers. Maybe you're looking for a preferred lab in 2016. They can help you find some of those preferred labs, again, to help maximize your out-of-pocket spend. So that's Accolade. Accolade can really help you with a whole host of things. And also it's kind of our conduit into services like Doctor On Demand and Grand Rounds and a whole host of others to really ensure that you're getting access to high quality providers and you're finding that right care. So don't ever hesitate to pick up the phone and call Accolade. They can help steer you and kind of lead you in the right direction.
Yeah, that's great. And you mentioned that as the concierge for the medical side. There's another company, ACO, that we use for the financial side.
Sure.
And those really are our two main hubs that we try to push people towards for answering great questions and getting the help that they need. ACO is a company that offers services on the financial side for any questions that you have about your finances. Could be anything from setting a budget to thinking about purchasing a home or leasing a car or renting how to just really pay for your rental expenses and things along those lines. So you can contact ACO, go to the My Benefits website to learn more about ACO. Through the U Plus Wellbeing, there's a 5-minute checkup that you can do, and really this is geared just for you to get a baseline of where you think you are for your finances. So it's a great, just a quick checklist of questions, and you can go through those questions and get some great feedback and take you out to the ACO website to find out more information about things you might be considering when you're looking at your budget and your finances and how you're spending your money.
Terrific. We can call them our financial concierge.
Yeah, I love that.
I've got the whole healthcare concierge.
That's right.
Okay.
So will the live chat be recorded and accessible at a later time? So the answer is yes. So you can actually visit us at the Google Hangout link, and you can rewatch the whole video. So that sounds like fun.
I know.
I think I'll do that later. But yeah, it definitely is available to you, and we definitely encourage you to share this with your colleagues, and yeah, it's definitely available to you and anyone else that you know would benefit from this.
Yeah, we're here to help answer your questions in a obviously very casual format. So feel free to send us any questions if you have some. And if you don't get your questions answered here by Dan or I, we'll reach out to you via email if we don't get to all your questions and give you the answers that you were looking for.
Right. And we're still getting great questions. So again, if you have questions, it's healthy_week@cable.comcast.com. Feel free to submit them.
Right.
So we got a great one about a service that we had introduced last year about Mequilibrium.
Yep.
You want to explain a little about Mequilibrium?
Sure. Mequilibrium, we call it MEQ for short, is a great service really kind of put in place to help reduce overall stress of our employees. You can sign up, you can get emails daily from MEQ or Mequilibrium, but they really give you some nice guidance and support and advice on how to manage your stress day to day. So encourage you, if you're interested or curious, you can go on and you can take a quiz to kind of help get a reading on the level of stress maybe in your life and kind of where you fall on that pendulum, and then decide and use the tools and resources that are available on MEQ to help manage your stress. So it's a really great resource, and I know many of my colleagues use MEQ and really like MEQ. I get daily updates from them, so that's kind of fun to read. But that's our kind of opportunity to help our employees and their family members kind of manage their stress. So a great tool.
And they've got a really cute tagline that I read. I get the subscription too. It's your morning cup of calm.
There you go.
And I love that. I think that's right in line to what I need every morning.
Nice. Better than caffeine.
Definitely.
Calm.
That's right. So what is your favorite video or feature on the Healthy Week website? So maybe I'll go first if you don't mind. I loved the Sharon Epperson video on the financial side. I thought it was she's just such an amazing person and has so many great tips. So if you haven't watched that, it's on the Financial Day, which was Thursday. Go out and take a look, and there's a great video by Sharon Epperson. How about you?
You know, in preparation for this, honestly, I watched Sophie walk through the Sleepio online chat, and that was really fun. Great. She's a great presenter, and she really gave everybody some great tips and resources on how to get a better night's sleep. So I actually really enjoyed that. She was very fun, and she has a lovely accent too. She's British, so she had a nice accent. So that was fun.
It was perfect for Sleepio. She was just so calming and so intelligent.
Yeah.
She did an amazing job.
Kicking off Healthy Week with a nice stuff.
It was great. So we have legal services, and someone once had asked, how do they sign up for the legal service?
Yeah, My Benefits. You need to go on every year and sign up for your legal benefits. That's a once-a-year election, so go on to My Benefits and sign up for legal. We also have other voluntary benefits such as auto and home owner's insurance. We have pet insurance. We have some AFLOC products. You can go on any time during the year, just like your 401k elections, that you can make any time of the year and make changes. You can go on and make and enroll and make changes to your voluntary benefit elections. And then you've got the convenience of payroll deduction, so even better. That too is available on My Benefits, but not require that you make those changes during open enrollment, with the exception of legal.
Excellent. So do I have to enroll in the EAP?
You do not. EAP is an acronym for Employee Assistance Program. We actually provide that to all of our employees. And that's another, you've had sessions to be able to see a therapist in time of need, but it's kind of a behavioral health service. So if you need to see a therapist and don't really know who to go to, it's free. Your first 5 visits are going to be free. And then if you need to have subsequent visits, that's where it falls into the health plan. That's where co-pays might come into play. But take advantage of EAP services that we provide to you in those first 5 free visits. And then the 6th and subsequent visits would be probably a copay under the health plan. So that's another great tool and resource to take advantage of.
Excellent. So is there a way I can get more health and wellness related updates year round?
We are. Our kind of global benefits team, communications team, really are focused on continuing to stream information out to our employees throughout the year. They do quarterly mailings out to employees. We'll have more information always available to you on My Benefits. It's probably the best place for you to go to for most up-to-date information. That'll constantly be updated for you, but we will be sending out quarterly updates and newsletters for all of you to keep you up to date on what's going on within Global Benefits.
Excellent. Yeah, and we're actually having folks who are interested to sign up for a mailing list, and it's on youpluswellbeing.com, and we'll constantly keep you apprised of things that are going on, and I think that's a really great way that we can all stay connected.
Perfect.
Excellent.
Any other questions?
I think those are the questions we got in so far. Well, we'd like to thank you so much for joining us today. We hope this was really beneficial for you. I know I had a great time. Thank you so much for everything you provided here.
Thank you. Thank you. I was kind of looking down very quickly at my notes. If you all want a really kind of a fun recap of Healthy Week and everything that's happened, you can actually visit the youpluswellbeing.com website in order to access tips and videos and learn more about all the programs that we've highlighted today, and also, again, to get a fun recap of everything that's happened during Healthy Week. So hopefully you've enjoyed this little informal session when Dan and I get to chat with you and help answer your questions. Again, if we didn't answer your question online, we'll get back to you via email, but thank you for everybody dialing in and asking questions. And any last remarks?
No, again, thank you. We appreciate you guys joining us, and it was a pleasure meeting everybody online.
Great, thank you. Bye.